Welcome back, everyone. My name is Alex. I'm your host. Welcome back to Pharmacist Corner. It's been a while, but thank God we are back again. And we need to continue our education, our interaction, just to know basic things that are necessary. Today we will be talking about drug administration. What are the things we need to take note of when we are using our drug? Drug is very important. It's not something that needs to be abused. In fact, it's said that drug is a poison and poison is a drug. If it's that important, we need to take note of some things while using our drug, and those are the things we'll highlight today. So today we are going to have some practical session. We're going to have some questions from people. We want to know their behavior. We want to know how they use their drug and how they what they think about their medications. So it's going to be interactive. Questions will be asked and we'll provide answer. Thank you.
Hi, my name is Islamia. I'm a student of University of Ilorin. So pharmacist, my question is that my roommates, there was a time she had a stomach upset about some weeks ago, and she got a particular drug. I don't know the name. So she got the drug, she used it, and she was very okay. She got better. And now too, I'm having the same stomach upset. Is it right for me to get the drug from her?
Yes, thank you, Islamia, for your question. It's very important to know that you don't share medication for no reason, for no cause. Now, the other fellow have a tummy upset. Yours may be from a different cause. Tummy upset could be from ulcer pain, it could be from menstrual pain, it can even be from a bout of food poisoning. It could also be as a result of underlying conditions that need to be investigated. And so you don't take a medication that is meant for somebody. Let your case be treated by the physician. Come to the prescriber. Even the pharmacist will help you to be able to know what is right for you. So don't share medication for no reason.
Hi there, my name is Helen. So there's something I've always wanted to tell the pharmacist. Whenever I'm sick or I go to the hospital, there's a need for me to use drugs, and I tend to still feel pains. For example, if I'm asked to use a painkiller, to use just one, and I still feel severe pain, sometimes I just go for 2 or 3 just to make the pain go faster. So I don't know if this is a good idea or not.
Okay, thank you, Helen, for your question. For every medication, there is a dose, and you are not expected to go beyond the dose. If you go beyond the dose, you have the risk of taking something that is toxic to the body. Now, for every drug, you have a limit that the body can take, and that is the therapeutic. The therapeutic index of the drug. Once you take beyond the dose, you are already causing a problem, and you don't want to do that at all. So just stay within the limit of the dose they are given. The effect of the drug is not necessarily related to the quantity of the drug that is taken. As a matter of fact, when you go beyond the recommended dose and you are taking a drug like paracetamol, you are supposed to take 1 gram, which is 2 tablets, 500 milligram. You are taking like 4 or 6. It's already going to a toxic level. So don't take drug for the sake of the way you are feeling. If you don't have responses that you expected, just go back to the prescriber. They will advise you. They will review your drug, peradventure give you something, review the drug, give you another medication that will have or elicit the desired effect. At the end of the day, when you take your drug, what we expect is for you to have a good prognosis. That is, you come out well and you are fine. But don't self-medicate. Don't in any way want to increase the dose of your drug. There are some drugs that have narrow therapeutic index. That is, if you take a little higher, in fact, it will be so toxic. And as I said earlier, all drugs are poison. All poisons are drug. What makes a drug a poison is when you take it in an overdose, it becomes a poison to the system. We don't want to do that. So please, let's take note and adhere to what is prescribed.
Good afternoon, my name is Dear Kola. I just want to put a more muscle to drug issue personally on me. I don't value using drugs for the periods of time they give me in the hospital or in the chemist or anything. I believe when you use the pills and you use for 2-3 days, and well, probably give you 7 days, and you use for like 2-3 days and you're good, I see no reason for you to complete it.
Thank you, Mr. Diekola. Nice question, by the way. And this is what we come across daily. You know, people said, oh, I've been given a drug in the hospital, in the pharmacy, and I've used 2-3 days, I'm fine, so why should I bother myself to complete the medication? Please, it's important you complete every medication given. If you don't want to even complete it, please talk to your prescriber. The prescriber will tell you if you need to stop the drug halfway, depending on what kind of medication. You know, it is the decision of the prescriber and not your decision. Now, you trust the prescriber before you go to him to prescribe the drug to you, and so you trust their judgment that what they have given to you for the duration of days is the right thing, and adhere to it. Let's go to antibiotics, for instance. That is the one that is most abused in this fashion. Now you have an infection and antibiotics have been given, and of course there's clinical symptoms, you know, these things you see before you start the medication, and once those symptoms cleared out to you, you know, for most people you just feel like there's no need to complete the medication. But trust me, it's important. For antibiotics, yes, you may not feel the clinical symptoms, you may not feel the signs, you may not see the itching, the discharge, whatever, but the bacteria that causes that infection needs to be cleared out of the system completely. And it is when you take the drug to the end of the, you know, the days prescribed for, that you have that clearance, and then you are free of the bacteria in the system. So it's very important for every medication, complete the dose. If you have issues along the line, assuming you are reacting, you're assuming there is an issue, you know, maybe, I mean, you are not comfortable with the drug, just talk to your prescriber. They will have the solution. They know what to do and advise you accordingly. Thank you everyone for being part of today's edition. We want to encourage you to follow us on our YouTube page, subscribe, like our page, share with friends. The comment box is there. Please share your view. If you have area of concern, let us know. If you have topics you want us to discuss, please feel free to suggest topic to us. We will work on it. We'll come your way again. Stay tuned with us. Thank you and have a lovely day.